Hi, I'm Andy. Hi, I'm a third-year dental student here at University of Texas Health Science Center at San Antonio, and I'm going to demonstrate how to use a Facebow. So the first thing I want to do is just talk about the different parts. This first part is the Facebow frame. You have the transfer assembly right here, and the bite fork right here. So we'll start with the bite fork. Basically, with your patient in the chair, what you want to do is put a little bit of blue mousse on there. On the top. So express a little bit on top. And you can put a little bit on the bottom if you want as well. Ask the patient to open up. Bite together. And just hold that right there. The blue mousse will just help to reestablish where he's biting down on the bite fork. So just give it a second to set up. So the blue mousse is set up. Open up for him. Okay. So we got enough of the teeth registered that he'll be able to bite down in the exact same place. That's really all you want to do. So place the bite fork back into his mouth, or in her mouth, and together. So while you're waiting for the blue mousse to set, you want to take your assembly and connect it to the Facebow frame. And you do that just like this. And screw it tight. Now the Facebow is intact. You want to bring it over to the patient. Loosen these thumb screws here on the side, just slightly. You can open it a little wider. Ask the patient to grab hold and place the earpieces in your ear. Okay. Now hold them together. And this is where you use the Nasion assembly. Push against the Nasion to get the proper measurement. Tighten when you're in the right spot. Is that comfortable? Mm-hmm. Okay. Tighten the thumb screws on the side as well. Now with the Facebow transfer assembly, connect that with the bite fork, like so. Okay, once that's tight, tighten the transfer assembly as well. This is an important part, to keep this tight. A lot of times this will come loose. Once that's tight, you have the measurements, so now you just need to take the Facebow off the patient by loosening the thumb, screws on the side and the Nasion. Ask the patient to pull it to the side and open. And now you have the Facebow. You can lay it upside down for the time being until you take it to the lab. Alright. So the next part will just be to transfer it to your articulator, and one of the parts that may be the most confusing. Once you have the Facebow done, you take the mounting assembly and the Facebow stabilizer, and basically you connect it to your articulator like this. Just put down portion. It's kind of intuitive how it fit onto the articulator. Once you have it like that, you take your Facebow, which you've made. Make sure it's tightened, obviously, so in this process it doesn't loosen and you lose the measurements that you've taken. Take it off, move it over to this portion, connect them like this. Take this piece, connect it to the transfer assembly so the top member of the articulator will be able to stop as it rotates forward. And take the pin out. And that's how it stops. This portion. And you can kind of spin this around until it gets high enough to support the lower end of the bite fork. And once you have the cast done and ready to mount, you'll be able to mount it on this Facebow.